Contrary to the traditional concept that aging means having a rest and enjoyment, more than 100 elderly people of Hong Kong Commune and Tianhai Town participating in the Health Promotion for the Elderly in Tianhai Taiping program have their truly active aging with voluntary participation in local community activities. Vietnam has entered the population aging phase, and aging will cause a series of negative effects on health, finance, social welfare. There is only one method to reduce those burdens. This is to help the elderly have a better well-being. As far as WHO's definition concerns, they will be healthier if they regularly exercise, not only to improve their physical health, but also their spiritual health. We piloted a model in 2 communes of Tianhai District, Taiping Province. About 60 volunteers were chosen at each commune. These seniors participated in programs on tobacco control and alcohol-related harm prevention and control, because drinking alcohol and smoking are 2 main reasons leading to non-communicable diseases. We taught them communication and counseling skills. They then were assigned to visit a cluster of 30 households surrounding their home, so they didn't have to travel too far. This allowed them to improve their health because of their movement to their neighbor's house. Moreover, when they used their mind to give someone advice on health issues, they were in high spirits. As a result, the combination between physical and spiritual activities would engage these elderly in the active aging process. That has been our philosophy, that was based on 3 important factors, including voluntariness, active participation, and local culture adaptation. Continuing knowledge and skill update. Since October 2010, having received the Public Health Association membership, those elderly public health volunteers, VPHAs, have been given training on skills for health communication and education, knowledge update for elderly healthcare, and provision of routine healthcare service. They also participated in community-based interventions on local public health problems. Diffusion to community. Following the hands-on method, EPHVs with their self-confidence have visited households to provide counseling, participated in the contest entitled Active Aging Inspired Community on the topic of reduction of tobacco and alcohol use with apparent promising results. Nearly 3,000 male adults aged 18 to 60 received interpersonal communication messages. 17.2% of tobacco users quit smoking. 57.8% do not practice smoking indoors or at places with no smoking signs. Alcohol use at low-risk levels is reduced by 8.5%.
Mình đã giữ gìn được cái sức khỏe của mình được tốt. Hai nữa là qua cái truyền đạt.
I remain in a healthy condition, and I communicated this with other elderly people in the neighborhood. Every 2 months, EPHVs organize communication sessions on health issues of the elderly and the community, such as prevention of hand-foot-mouth disease, cancer, hypertension, diabetes, tuberculosis, vascular and skeletal disease, injury, and the nutrition of the elderly. More than 200 communication sessions, over 60% of elderly people getting involved. Blood pressure measurement being given to 1,310 elderly people. 2-way impact. VPHA conducted a quantitative study using a standardized questionnaire to evaluate the quality of life between EPHVs, the case group, and the non-EPHVs, the control group, in Tianhai Town and Hong Kong Commune. After 2 assessment rounds, findings from the study show that the total score of the EPHV group's quality of life is better in a statistically significant manner than those in the non-EPHV group, who were not involved in the program. The outcomes of the program have been highly appreciated by local authorities, the mass media, local and international organizations. Particularly, technical assistance has been provided by the International Life Sciences Institute of Japan to the training of the Take 10 program, including nutritional intake and appropriate exercises for the elderly. Positive impacts have been clearly seen through this program, and it's our proposal that VPHA and relevant agencies provide training and guidelines to EPHVs to implement some other activities. Recognizing the program's benefit to the community, on the 22nd of May 2013, Tianhai District Committee promulgated a Directive Number 25 on continuing expansion of the health promotion for the elderly program to cover 4 other communes in Tianhai. This program is also planned for expansion in 2 other provinces, namely Khánh Hòa and Dong Thap, as well as other provinces and cities in order to respond to the rapid population aging in Vietnam. For the better quality of life of Vietnamese elderly,